Hello, my name's Karen Davies and I work as a diabetes nurse specialist. I also deliver training for the NHS Health Check programme, which is a cardiovascular disease prevention service. In this short video, I'd like to give you some information on the HbA1c test and how it can be used. In health terms, HB stands for hemoglobin. Hemoglobin is a protein molecule on the red blood cell. We know that the lifespan of the red blood cell is approximately 120 days. We also know that glucose or sugar attaches itself to the red blood cell. So the higher the blood glucose level, the more glucose that attaches itself to the red blood cells. The hemoglobin alpha-1c therefore is a test that averages out the blood sugar level over the last 2 to 3 months. Along with the fasting plasma glucose, the HbA1c can be used as a diagnostic tool of diabetes. It's also used to measure ongoing control with somebody who has diabetes. One advantage against the fasting plasma glucose is that the person doesn't have to fast to have the test. We also know from research trials there is an evidence base in terms of reducing the HbA1c and to improve outcomes. Some of you may be used to HbA1c being expressed as a percentage result. However, since 2009, the UK are adopting the IFCC, International Federation of Clinical Chemistry, unit of measurement, the millimoles per mole. A normal HbA1c result is a reading below 41 millimoles per mole. A person would be classed as high risk of diabetes if their result was between 42 and 47 millimoles per mole. This is classed as pre-diabetes or non-diabetic hyperglycemia. Our current NICE guidance for adults with type 1 and type 2 diabetes advises that we target a HbA1c of 48 millimoles per mole. However, it's really important to individualise targets for the person in front of you, especially if they're at risk of hypoglycemic episodes or low blood sugars and they have no hypo-awareness. The HbA1c, if it's not in target range, might be tested 3 to 6 monthly. Otherwise, it might be at 6 monthly to a year interval. There have been 2 large-scale clinical trials, the DCCT and the UK PDS, that both have proven that by reducing your HbA1c by 11 millimoles per mole, you can reduce the risk of microvascular complications by 25%. A person can reduce their HbA1c by making positive lifestyle changes. These might be maintaining a healthy weight or increasing up physical activity. A high body weight or large waist measurement can increase your risk of developing type 2 diabetes. To maintain a healthy weight, refer to the Eat Well guide. This encourages you to eat at least 5 portions of fruit and vegetables every day, with a higher focus on vegetables. Increasing fibre and whole grain foods while reducing saturated fats can also help you to maintain a healthy weight. Current physical activity guidance advises 150 minutes of moderately intense activity. This is when your breathing rate and body temperature increases. We are all advised to sit less and to move more, ideally achieving 10,000 steps in a day. Any patient with results greater than 42 millimoles per mole should be referred onto their GP. For further information, visit diabetes.org.uk.